y'all, it's your girl Ashley, and you're listening to Sex with Ashley podcast, where we talk about pleasure, sex, relationships, and how to feel confident in your body without the shame. If you're ready for real talk with real tools, you're in the right place. Now let's get into it.
All right. Today you're in for a special treat, everybody. So today I have Dr. Jackie in with us today. Dr. Jackie, how are you?
I'm wonderful. How are you, Ashley?
I'm good. Right before Thanksgiving, but
Yeah, I know, right?
hey. So Dr. Jackie, for people who know you from Married to Medicine, right? And that's not a clinic. So what does a day look like being an OBGYN off camera?
Now, you really want to know the whole truth, Ashley?
I do.
All right. So, off camera, Dr. Jackie gets up between 5 and 6 o'clock in the morning.
Okay.
She does her quiet time, her prayer time, and she listens to podcasts while she's dressed.
Okay.
Some mornings I'm going to work out. Some mornings I'm going straight to surgery. And from there is to the office.
Mm-hmm.
And from the office, I have a multitude of meetings after that.
Okay.
And then somewhere in there, I find some sleep.
Okay. So you have a very busy life.
Yes.
And so in between all of that business, you found the time to write this book.
I did.
Now let me tell you about this book. So I love this book. So
Thank you, Ashley.
I did a workshop about like what is it? How you name the vaginas?
Uh-huh. The vagina. Yeah.
Pussies. But I did a workshop on this using your breakdown a year or two ago, and everybody loved it. And I was like, it came from Dr. Jackie's The Queen V book.
Yeah.
You have to go buy it. So what motivated you to write this book? And what is one lesson you wish every woman would learn about their vaginas, like in high school?
So I grew up in a small town in Mississippi, and nobody would talk about the vagina, and we never used the word vagina. Mm-hmm. We called it everything else. And, your mama had names for it, pocketbook, and all kinds of names, but never said the word vagina.
Right.
And it was almost a shame attached to the vagina. And so I wanted to dispel that myth that is something we should be ashamed of. And there's so much misinformation out there about the vagina that I wanted to make sure that I could give you a little bit about everything when it comes to the vagina. And I named it the Queen V because I think the vagina is royalty. I mean, you tell her who she is and she will follow. So I wanted to make sure that there was no shame attached to the word vagina and having a vagina.
I agree. And I love how you did that so well in this book, because you talk about all different types of vaginas. You identify with every woman. Like, I love it. Speaking of vaginas, let's talk about discharge, right? A lot of women think discharge is unhealthy, and they don't know what discharge is, when you're supposed to have it, that is normal, all those things. So let's talk about what healthy discharge actually is, and then how it changes throughout a woman's cycle.
So I'm glad you asked that question, and let's dispel the myth, because I often have patients who come in the office and they say, Dr. Walters, Dr. Jackie, I have a vaginal discharge. And, after that, you have to ask other questions. Is there itching? Is there odor? How long has it been there? Anything new? Anybody new? So we have to ask questions. A normal vaginal discharge, if you know anything about acid and base, it should be acidic, about 3.8 to 4.2. And it should be white to clear. It should not have an odor, or it should have its own odor. And that's the one thing about the vagina I want women to understand. You have your own natural odor. So it's not supposed to smell like strawberries and peaches and cream. It can have a musky odor, but not a foul odor. And what can disrupt that, or cyclic, is going to change. When you're around the ovulation period, you got that egg white, slippy, slimy discharge where the sperm can penetrate through and get to the target. Okay. After that, it may become a little thicker and white, but it should not be green or yellow or gray color, and it certainly shouldn't have an offensive odor. If you ever think your vaginal discharge has an offensive odor, you need to call your doctor.
So can we talk about discharge right quick? Odor. So what I've learned as someone who talks about sexual health with women, right? And sometimes with men too. What I've learned is we don't know what an unhealthy odor is. We assume because it's an odor that, oh my God, something's wrong. And then, sometimes with men's lack of ignorance, they don't know either. They, well, it has, even if it has a musky odor, oh, something's wrong with you. This is not how it's supposed to smell. So talk about that a little bit. What are the smells that are healthy if you happen to like, what should your vagina smell like? We know it doesn't smell like roses, it doesn't smell like perfume, but what should it smell like?
And when I say the word musky, it is almost, and I don't want to say oniony,
Okay.
but it's somewhere in that aroma where it gives you that, I know that I have a vagina down there.
Okay.
Now, believe it or not, medicines, supplements can change the aroma of the vagina. And I say aroma because I use that word where it should be pleasant. It shouldn't be offensive.
Okay.
Now, if you ever get, and so that's as much as I could tell you, is everybody's going to have their own odor. It shouldn't be a foul odor. Now, after your period, you may notice a metallic smell because the iron breakdown from blood may give you that. But if you start to get, I say, if you start to go to the grocery store, if you get a seafood fishy odor, there's something wrong. If you get that yeasty smell, might be yeast, there's something wrong.
Okay.
But I certainly tell women, get comfortable with knowing what is your own odor or aroma and not call it offensive just because you don't like the fact that you have an aroma.
That's really good. Good. All right, let's talk about pH for a second. So, what are some things that can throw off a woman's pH?
So as we were saying, a pH is around 3.8 to 4.2. So it's acidic.
Okay.
And things that can throw off your pH are things we do every day. Having a period can throw off your pH.
Okay.
Semen can throw off your pH. Tampons, definitely douching and putting products in the vagina can throw off your pH. People can throw off your pH. And so be mindful of, and that's why I often ask the question, is there anybody new can throw off your pH? So there are things we do every day that can throw off your pH. And what causes a normal pH in the vagina is we have a particular bacteria that is supposed to be there. It's lactobacillus. That's the main one. And if that lactobacillus is disrupted, or your ecosystem, I like to refer to it as, if it is disrupted and your vagina is no longer acidic, then you now are susceptible to infections and different scents.
Okay, so how do we, once our pH is thrown off, how can we reset it to normal?
So a lot of women come in and say my pH is thrown off, and I'm always like, well, how?
Okay.
And I know they're buying the pH kits over the shelf and they're coming back with that, but I'm like, well, did you have blood when you did it? So we don't always take that. But women who come in with recurrent vaginitis, yeast or BV, or recurrent irritations or odors, then we always do tests to see. But we're not testing your pH. We're testing to see if you have the lactobacillus that you're supposed to have there, or if you have candidiasis, which is yeast, or bacterial vaginitis.
Okay. I was told this one time. I was told because you brought up BV. So I was told that for people who have reoccurring BV, like boric acid, stories were helpful. But then online, sometimes you hear about people saying that it's not helpful. So are they helpful?
So BV is not our first line. Boric acid is not our first line of treatment for BV, but we use it as a part of the therapy. So if a woman comes in and she's had recurrent BV for whatever reason, we use it as a part because first line is to treat them. We give them medication. If it keeps coming back, it's reoccurring multiple times, then we will definitely use boric acid to reset the acidity in the vagina. Now, it's a suppository, Ashley. I had somebody who came in and said it didn't taste good. And we don't want you to put it in your mouth. We want you to put it in your vagina. And we get them compounded. So you see different pH, boric acid online. We typically have ours compounded by the compounding pharmacy to make sure you're getting exactly what we want you to have.
Okay. And this is probably not a myth anymore, but people sometimes still do this. Let's talk about it right quick. douching. I know back in my mother's generation, douching was a thing.
Yeah, not just your mother's generation. They still sell thousands and thousands of dollars worth of douching. And we tell you never, ever, never, ever douche. Why? Unless we tell you to douche.
Okay.
Never douche because you are flushing out that lactobacillus that is supposed to be there. We just spoke saying
Right.
you want it to be there. So when you start washing out what is supposed to be there, now you're making yourself more susceptible to vaginitis.
So when is douching appropriate?
And I said that, and I said that because when I have women who come in with, I forgot and left the tampon in,
Gotcha.
and they'll come in with this horrible odor and horrible discharge, and we find a retained tampon. And when we remove it, that is the only time I will say to a woman, it is okay to douche just one time.
Okay. All right. Let's talk about something that probably affects a lot of people of color, women of color. Fibroids, PCOS, right?
Yes.
How do these conditions intersect with vaginal symptoms, and and sex comfort?
Well, a fibroid is a smooth muscle. The uterus is made up of smooth muscle. And for whatever reason, something comes on and we start to grow these little small tumors that can become huge tumors. I've seen
Right.
tumors as big as a baby
Okay.
and, and as small as a pea.
Okay.
But these are small muscle tumors that grow in and around the uterus.
Okay.
And if they are in certain places and they're protruding into the vagina or they're on the posterior surface of the uterus and you're having sex and these fibroids are getting hit, it's ouch, ouch. PCOS does the same, it comes with a lot of irregular bleeding, and it is a metabolic disorder that affects a lot of different areas in a woman's life. And if you're bleeding heavily and irregularly, then obviously you're not having a lot of sex, so it's disrupting your sex life. Just like endometriosis. Endometriosis is where the endometrial lining is now growing outside of the uterus. It can implant on the ovaries, on what we call the uterosacral ligaments. It can be in multiple places, bladder and bowel. And if you're having sex, it's painful. And it's just like having your period and you're hurting. It can be just as painful as that.
So if someone does not have pain, they can still have fibroids, but just don't know it.
Absolutely. Absolutely. And that's why we tell you have an annual visit every year. I know patients are saying, well, they told me don't have my pap, but every 3 to 5. Well, you're not just coming in for a pap smear. You're coming in for other things, whether you're talking about contraception, getting pregnant, not getting pregnant, irregular periods, vaginal discharge. So we want you to have an annual visit with your OBGYN.
Okay, good. Because I go every year. I don't listen to that 3 to 5 year window because that's won't be killing me. I'm going to go every year to make sure everything is.
And we want you to come in, Ashley, and I'll tell you the strangest, the most unusual finding I found in the vagina, believe it or not, was melanoma.
Really?
Yeah, we think of melanoma as a mole that's just on the skin. Melanoma can grow in other places like the vagina.
Oh, Lord. Yeah. Okay. Yeah. I'll be in. Yeah.
Yes.
So I asked my audience I didn't tell them you were coming, but I told them I had a OBGYN on the show and that they had questions to submit questions. So here's some questions that they submitted. So one question was, so what are some ways to keep your fertility window open if egg freezing is not an option due to financial reasons?
Well, we definitely advocate freezing eggs if you can before the age of 35 to 40. But if you can't, things that you can do is, diet and exercise is always going to be queen, or I like to say queen and not king, but queen in every woman's life. Maintaining an ideal body weight, not smoking. I see a lot of women hookah. They're smoking hookah. Try to stay away from smoking, alcohol. But again, it's just taking care of the entire body. And believe it or not, stress. Stress kills. So we're telling women, if you can kind of keep all of that in control, you can maintain healthy eggs. But I'll be honest, there is some genetics involved in that.
Okay.
If mama went through menopause early, you may be that person who's going to go through menopause early. So you have to respect the genetic factors.
Okay. I've noticed that a lot of women are having a lot of women aged 35 and older are now
Mhm.
having babies, six like more than usual, maybe.
Mhm.
So
Mhm.
I'm that age group. But a lot of people that I went to college with, a lot of people I'm friends with, are now having their first baby at 38, 39, and 40. So I don't want any children, but it gives people who are in my age group, I think, hope to know that we can still, because like you hear, because what is it, after 35 is the geriatric pregnancy? Here, if you're 35, you can't have kids. But now people are having kids later in life.
Mhm.
I think that gives people hope.
Well, the thing about that, Ashley, is there's about a 25% chance every month that a woman can get pregnant.
Okay.
Right around the age of 35, that fertility rate starts to drop.
Okay.
Right around 40, there's a significant drop, but there's this crossroad around 35 where your fertility rate is dropping, but your risk of abnormal genetics in a child start to go up. So that's kind of why we're talking. And then the risk of hypertension and diabetes and other things that can occur start to go up as we age. So yes, we're saying 35 is considered geriatric, and I don't know who came up with that term. We liked advanced maternal age, but somebody started calling it geriatric pregnancy. But we are telling you that risk is of all of that stuff is starting to go up around 35. Go down fertility rate, go up for everything else.
And the question I had. So I know as someone who's born female, we are born with the amount of eggs that we're going to have, and we don't create anymore.
No.
So let's say someone is on birth control, and birth control, it stops you from releasing the egg, right?
Huh?
So
Well, some birth, yes.
some does, some do.
Uh-huh.
So that means that you still have your eggs for a longer period of time than someone who wasn't on birth control. Is that what that means? No? Yes?
Kind of,
Okay.
kind of. You still have a certain number of eggs and you're not ovulating, is what you're
Okay.
saying.
Yeah.
Yeah. I mean, but we lose eggs for other reasons too, just based on age and other damages that we cause to the body.
Okay, cool. All right. Another question was, what is the best way can we re-regulate your microbiomes after your period?
So one thing is no douching. We already talked about that. Don't douche. I am a big believer in feminine health probiotics.
Okay.
And those are the probiotics where we're putting that healthy bacteria back into the vagina.
Okay.
And then try to limit your tampon and pad wearing to only those times when you really need to do it.
So free ball it. So
No, I'm not into free balling it. I am just saying if we are not bleeding heavily, a panty liner. Don't use a tampon. Don't use large pads.
okay.
Divi cup is an option as well. So you have other options. And then I believe in showers more than baths.
Why?
Because I just think when we're in the tub, we're putting bubble baths and soaps in our tubs. And I've had patients to tell me, I just kind of opened it up and I put the water in there. If you're in the shower, you're less likely to do that.
Okay, that makes sense.
Yes.
Okay. Next question is, I know several women who refuse to put their daughters on birth control due to concerns that it causes infertility.
Mm-hmm.
Is true.
So I think that fear is maybe deeply rooted in the fact that they're concerned about if their fertility is going to return to normal after they stop the hormonal birth control. And so I've partnered with Organon to share credible information about women's health. So when you stop using a hormonal birth control, your body typically returns to its normal state. So that means you're ovulating again. And there are serious side effects associated with birth control. So make sure you talk to your doctor. But for the most part, if you're using a hormonal birth control and you stop this birth control, you're going to return to your normal healthy state. For example, women who use Nexplanon, it's a long-acting reversible contraception that is implanted in the arm. You may be able to conceive within a week or so after you remove the Nexplanon. So Nexplanon provides protection for up to 3 years. I said up to 3 years, and you don't have to do any weekly dosing or monthly dosing or daily dosing. And you definitely want to have this inserted and removed by a health professional. But let me say again, it needs to be removed by the end of the 3rd year. So then, you know, I have patients who have come past the third year, but the recommendation is to remove it by the end of the third year.
So I'm on Nexplanon.
Mm-hmm.
Little known fact. So I'm on my third cycle of
Yeah.
Nexplanon. So I got on Nexplanon when I was 30. 30? Yeah, 30. So I've been on birth control since I was 18. I got on birth control when I went to college. My mom was like, "You want to get on birth control?" Sure.
Mhm.
So I've been on birth control since I was 18, and I got off of it for like 2 or 3 years after college, and then I got back on Nexplanon. So birth control for me has been fine, because some people ask me about my birth control journey. Birth control has been fine. I haven't had any issues. I know everybody is different though, but Nexplanon, I love it.
Good. Good.
Because
I do too.
yeah, like you put it in your arm and I don't have to worry about the first one. I was on the patch, and the patch was fine too, but you have to change it every week. And then
Mm-hmm.
I was on the pills at one point in time, but you have to take those every day. And I don't like taking pills every day because I forget. But next one, I just put it go to the doctor and put it in my arm. And then it's there until your 3 years.
Yep.
They take it out, and then my doctor put it in the same arm. So she's like, I didn't have to switch an arm. So she could take it out and put it in the same arm. But I love it.
Good. And if you chose to get pregnant, Ashley, you can remove it anytime. Well, we can remove it
Yes.
in any time during those 3 years.
Yes.
And bam,
There
you
you
can
go.
return to getting pregnant.
Yeah, I was talking to someone actually this week because her doctor had told her about Nexplanon, and she had questions, and she asked me about like the needle that they use.
Uh,
They numb, and so there is a lot of needles they use, but it doesn't hurt because you're numb and stuff.
yeah.
And so you may be sore, I don't know, maybe a day or two, but that's pretty much it.
Yes. I rarely have patients complain of any significant discomfort with the insertion.
Yeah. So last question, Dr. Jackie.
I'm so sorry. Before we move on to the next question, could we just read the major statements?
Absolutely. Okay. It is important for women to know that they shouldn't use Nexplanon if they are pregnant or think they may get pregnant, have or have had blood clots, have liver disease or a liver tumor, have unexplained vaginal bleeding, have or have had certain cancers. Women should tell their doctors if they have diabetes, high cholesterol or triglycerides, headaches, gallbladder or kidney problems, history of depressed moods, or high blood pressure. As soon as Nexplanon is placed, the woman and her doctor should check that it is in her arm by feeling for it. If at any time the woman can't feel the implant, she should contact her doctor right away and use a non-hormonal birth control method such as condoms. Removal of the implant may be very difficult or impossible if the implant is not where it should be. I also explained that while uncommon, ectopic pregnancy, which is a pregnancy that occurs outside the womb, can occur while using Nexplanon. It can be life-threatening and may result in loss of pregnancy or fertility. With Nexplanon, women are likely to experience changes in their period. Ovarian cysts may occur and usually disappear. Nexplanon may increase a woman's chance of serious blood clots, especially if she smokes or has other risk factors. Blood clots can cause heart attack, stroke, or death. I make sure to remind them that Nexplanon does not protect against HIV or other STDs. To learn more about Nexplanon, talk to your healthcare provider or visit nexplanon.com.
So in conclusion, Dr. Jackie, if you could give every listener a permission slip for their sexual or vaginal health, what would it be?
If I could give them a
permission slip or tell them something that they should be doing for their sexual and or vaginal health, what would it be?
For every woman who has a vagina, I would tell her to make sure she sees her doctor annually, that she is not using any products in the and around the vagina.
Okay.
And it is royalty, so treat it like it is.
Treat it like the queen bee that it is.
Yes.
Yes. Thank you, Dr. Jackie.
You are so welcome, Ashley. Thank you so much. And it has been a pleasure chatting with you.
Thanks for listening to Sex with Ashley. If you learned something today, do me a favor and send me a review and share this episode. And if you want more guidance, you can also purchase my book, Pleasure Please, available at Amazon, Barnes & Nobles, and wherever books are sold. Love you. Mean it. See you next week.